good afternoon. Today we are going to talk about common mistakes that happen in medical coding. Okay, so common medical coding mistakes and also the fixes. Now, when we talk about insurance, revenue cycle, so anything related to that, we always have some or the other incident or news where a fraud has happened. Okay, because there are some ways where you can easily do a fraud. We also see many insurance people who have taken insurances. They want to claim insurance by uh, faking fake admissions, okay, in the hospitals. So there are different ways where either the insurance company or the patient or the doctor, they try to make uh, fake claims so that they get higher money or they get their reimbursement back. Now, it could be a intentional thing that you do, intentional mistake. Okay, intentional, it will not be a mistake, but intentionally you want to cause a fraud. Okay, or it might be due to some mistake. If you're not too thorough with your coding skills, you're not very well aware with your anatomy and physiology, with medical terminologies. Okay, you are very passive in your coding, you're not actively understanding the medical record. So in those cases, you can unknowingly cause a mistake. Okay, now what is the impact of that mistake? We all know that medical coding is part of the revenue cycle. So when you do the coding, it goes to the billing department and then they submit the claim to the insurance company, and then the provider or the physician who has treated the patient gets the payment. Okay, so when any mistake is happening in the coding, either you are giving too many codes or you are giving too less of codes. In either scenario, there is a shift in the reimbursement. Okay, so if you are doing too many codes, then the insurance from the money deducted from the insurance of the patient is higher, so the patient is at loss. If you are undercoding or you are using less codes, okay, then the provider will get less money for his consultation. Okay, so either ways, it is not ideal for the revenue cycle. So here we can discuss about two codes mistake, coding mistake, that is upcoding and undercoding. So upcoding is billing for higher service level and undercoding is missing billable services. Okay. So upcoding in the sense, there are some codes which contain multiple scenarios or multiple procedures that have been done. Okay, or you can say there is a investigation panel, like the most common one is your obstetric panel. So when I talk about obstetric panel, so I know in an obstetric panel these many tests will be included. There will be a CBC, there will be a urine analysis, there will be HIV HbA1c testing. So I know when I say an obstetric panel, all these tests will come into that panel. Now there is one code which is there for obstetric panel. So I have to select that one code. But instead of selecting that one code, I am giving each code for all the investigations which are part of the obstetric panel. Okay. So I'm taking one code for CPC, I'm taking one code for urine analysis, I'm taking one code for HIV, HbA1c. Okay. So instead of one code that I was supposed to select, I'm selecting three codes. Okay. Or the patient has been uh, admitted in the emergency for a sprain, but I have taken a code for a fracture. Again, fracture will have a higher reimbursement value than the sprain. Okay, so in such cases, you have given more weightage to the code than that was required. So that is upcoding. Now, what is undercoding? Now, there is a patient who has been given certain procedures. Okay, 2-3 procedures have been done, but you have failed to catch the third procedure and you have selected only two procedures. Okay. Or there were multiple diagnoses to be coded. You have taken only few diagnoses you fail to code. Okay. So in those circumstances, you have done an undercoding. Okay. Or in certain procedures where you had to select two codes, you have selected only one code or you have not selected a modifier. Okay, like an x-ray of right and left, both was done, but you have not selected the uh, modifier and you have just written one code. Okay, so in such scenarios, what will happen? The provider or the healthcare professional had given his services, but he has not received the complete payment for his services. Okay, so when repeat sometimes it may happen by mistake because human errors are possible, but if repeated errors are happening, then there will be repeated denials. And if repeated denials are there, the time taken for the revenue to reach the provider or healthcare professional is delayed. Like if supposing today I have seen the patient, I'm supposed to get the payment within 10 to 15 days. But because of the denials, now my payment I will get after 20 to 30 days. Okay, depending on case to case. Okay, so now what will happen? I'm running a clinic over here and I have to pay my staff, I have to pay the bills, I have to procure all the inventories. So if my payment is delayed, how am I supposed to pay my regular operations, right? So in such cases, I will lose my revenue. There will be a problem in running the clinic. And when repeated denials are there, it also attracts audits. Okay. Audit, there could be external audits also, the from the organizations or the government which can come and do the audit if there are repeated denials or some fraud is detected repeatedly in the revenue side. Okay. Like the patients may complain repeatedly that their insurance is deducted for more money than required. Okay. Then in such cases, if too many complaints are happening, then it may also attract an audit. So denials, whenever the insurance company does a denial, so there could be many reasons for the denial. But one of the main reasons for the denial is if the coding is not done properly. Okay? The medical billing person, he takes the codes and he gives the monetary value to it and submits it. Okay? But if the coding is only not done properly, then the submission will not be done properly. Okay? And then the insurance company will deny it. Okay? So many denials occur due to incorrect codes, missing modifiers. And modifiers are a very essential part of CPT codes and XCPCS codes. If correct modifiers are not applied, it may lead to a denial or lack of medical necessity documentation. Okay? Certain test is written, okay, or certain investigation is written. The but why is that investigation required? There is no signs and symptoms. There is no clinical history which suggests that this investigation has to be done. So there has to be some documentation or some investigation finding is written, but there is no relevant document to authenticate that this test is really done. Okay, so whenever the coding does not just restrict to understanding the record and do the coding. It is also cross verification of all the documents which are required in that authentication of the medical record. So all these can lead to denials. Conducting internal coding audits ensures compliance, reduces mistakes, and improves claim acceptance rate. Now, whenever we talk about any organization, there is a process, a flow of the process. Now, there are too many people involved in the process. So there might be some problems in the process here and there. So if we do regular audits, so this mm, disruption in the flow process can be reduced. Like the staff keeps on changing or some rules and regulations change. Okay. So whenever we design a process, it's not going to be the same every time. Okay. There could be many factors which could influence the process flow. Okay. There could be some natural disasters, anything. Okay. So whenever there is a disruption in the process, there might be effect on the revenue cycle. Okay. So repeated audits when we conduct, we ensure that the process is flowing smoothly. If any problem is happening, it can be understood and fixed as soon as possible. Okay. So this reduces a lot of mistakes that might happen because of a disruption in the flow of processes. How to avoid upcoding? We can have regular billing process audit. Okay, so audit is the best way to ensure that there are no mistakes happening or the mistakes are minimized to the minimum. Okay, regular check and balance, review claims timely. Okay, so when you do audits also, um, or you can say it's not necessary every time you have to do an audit, but on a daily basis or at least weekly basis, if we do a checkup, like if the processes are going smoothly, if the timely reimbursements are happening. Okay, so if you make an attempt to understand the daily operations or a weekly operations, then the audits also might reduce. Okay, ensuring coding accuracy, the coders need to ensure that they are doing the best in selecting the code, and that can be achieved by having expert coders. Utilize the efficient EHR system. So when we are talking about, like in the previous slide I spoke about, that it is not just the medical record that has to be seen and coded. All the attached documents have to be reviewed for a selection of a code. Okay, so how are you going to do that? It can happen only when you understand the EHR properly. You know where the documents are there, you know where the investigation reports are there, you know where the uh, referrals are there. Okay, so you know exactly, if I want to authenticate a certain thing, where should I look in? Okay, so navigating to the EHR system efficiently is also going to add in selection of proper codes. Okay, and if there is regular mistake or someone is doing a fraud intentionally, okay, you might have to take a legal action to avoid any possible uh, action from the government or from the higher authorities. Okay, so that is also one. Compliance with the HIPAA laws is very crucial in medical coding, billing, and the whole of revenue setting. So compliant with the HIPAA rules is also very mandatory. And if there is any breach in the compliance of the HIPAA laws, legal action can be taken. Now, about undercoding, assessing lower level code then documented. That is, again, we've already spoken what is undercoding. You are assigning a low level code than what is actually required to do. Like the patient came with fracture, but we are taking a sprain code. Okay, code for a sprain leads to revenue loss and inaccurate patient records. Example, not coding for all billable procedures. Okay. Now, in certain procedures, like in cardiology, we have too many procedures that can be done at a single sitting. Okay? Because cardiac care is something where it is an emergency. Patient requires immediate care. So you can't be waiting, okay, we have done this procedure, now tomorrow we will do another procedure. It cannot be that. In one sitting only, we the patient might require too many procedures. Now, and in understanding that document, if you miss some of the procedures, now cardiac care is something which can be very expensive, especially in emergency. You might have to put a stent, you might have to put a pacemaker, you might have to give a resuscitation. There are too many medications which are used. The skill of the doctor, the nurses is required. Okay. So in so many things, when too much of money is being put behind the patient, too much of skill is put behind the patient, and then you miss out on few procedures, then it's going to have a huge effect on the reimbursement. Like if two stents were put, you have coded for only one stent. You have not understood properly. So one stent, loss of one stent code, okay, is going to be a huge effect. Okay. So like that, the revenue received by the physician can be marginally low or it can be very high margin low. Okay. So if it is a very high loss, then it will be difficult for the healthcare provider to run his organization. Okay. So whenever undercoding is happening, it is always a huge loss for the physician. Okay. When there is upcoding, there is a huge loss for the patient. Now, I have already spoken that you have to be compliant with the coding regulations. Okay. So when I talk about compliant, accuracy is part of compliance. Okay. So accuracy in documenting the medical record, accuracy in selecting the codes, accuracy in selecting the right modifiers have to is part of your compliance. Okay. So correct coding, modifier usage and claims processing, compliance with regulatory guidelines, meeting with medical necessity requirements, proper documentation, value-based reimbursement, fraud prevention and legal compliance, and HIPAA compliance. Okay. Now, if in certain organizations repeated upcoding is happening, okay, so then what will you think that why is this repeated upcoding happening? Is it some kind of fraud happening in this organization? So we will have to check. Okay. So this will attract audits from higher authorities or complaints from higher authorities. Okay. So if something fraudulent is detected, then according to HIPAA law, there could be very strict actions that can be taken, even to the extent that you might have to give a very high penalty, or you might even put into jail. You might lose your medical license. Okay, depending on the level of fraud that is happening. If repeated upcoding, undercoding is happening, that means you know there is something wrong, but you are not taking any action to resolve it. Again, that is a lack of complying with the HIPAA laws. Okay, so again, that might attract legal action. Okay, so when we talk about compliance, it is not just abiding by the rules and regulations. In the rules and regulation itself, accuracy is one of the things which is taken into account. Okay. In the billing department also, they have to maintain the correct base values to the codes. Okay. Over there also, they cannot give different base values to different codes. Okay. Just to get a higher reimbursement. That also cannot be done. So basically, every department, whether it be medical documentation, whether it be coding or billing, every department has to be accurate in the work to be compliant with the rules and regulations. Medical claim denials, common reasons. We have already discussed that. We will uh, review it again. First is missing information. If the medical documentation is not done properly, there might be uh, any diagnosis which is not written complete, or any information procedure which is not given complete. Okay. So there could be lack of information or incorrect information. Second, lack of authorization. and patient eligibility. So you need to check whether before the patient is taken for consultation, the first thing that is done is the eligibility of the insurance of the patient is checked. Whether this particular doctor is there in the panel of the insurance, if the doctor is there, what is the type of insurance the patient has, does the patient have to pay completely or it has a copay, or is the uh, uh, insurance of the patient eligible itself, is has it expired. Okay, so all that needs to be checked before the patient is taken for consultation. Otherwise, what will happen? The patient will be taken for consultation, and then when you go to the when the patient has to pay, you realize that you are not part of the panel or the patient's insurance is expired. Now, who is going to pay to the doctor, right? So before that only, before the patient is taken for consultation also, the eligibility is checked. Now, if patient's eligibility is not checked, you have done the coding or you have done the charting also, you have done the coding also, and it is sent for claim submission. And then they realize that this patient is not having a valid insurance. Okay, then again it will be denied. Medical necessity. Sometimes patient does not require treatment, but the physician has written the treatment. Again, it could be a malicious intention to get a higher reimbursement. Okay. So whenever some procedure is documented, some investigation is documented, some treatment is documented, you need to understand whether it is correlating with the signs and symptoms or with the patient history. Like patient is having chronic pulmonary disease, and every time the patient is coming, the physician asks them to do a PFT test. Now, in chronic cases of COPD, you don't require a PFT in every uh, follow-up. Okay? In every follow-up, you don't require. A PFT is required only when there is an acute exacerbation of the symptoms. Okay? But every follow-up the patient is being asked. So what is the necessity of asking in every patient, every follow-up? Is there a necessity, right? Or today the patient has been asked for a PFT. So why was the PFT required? Did the patient have some acute complaints? Is the condition of the patient worsening? Okay. So all that needs to be authenticated before you submit the codes. If there is no medical necessity which is authenticated, again the claim will be denied. Duplicate claim or service. So the claim of one patient has been submitted twice. Again, it will be rejected. Or a certain service has been documented twice. Again, it will be rejected. Limit for filing expired. There is a limit, there is a time frame given for uh, claim submission. Okay. If you do it after that, again, it will be denied. Service not covered by the payer. So that comes part of the eligibility check, that if you have not checked it properly, then again the medical will insurance company will deny, saying that this payer is not covered. Okay. So when a denial, when the claim submission is done, there is payment posting over there. That time, the lot of claims are denied. Okay. So when a denial is happening, what is the next step? Are we just going to sit like that, do nothing? Okay, I'm sorry, the claim was denied. We cannot do anything. No, the billing person understands what is the reason for denial. Is it that the coding was not done properly? Is it that the medical document was not done? Is it that the billing person did some mistake? Is it that the patient insurance not eligible? Okay. So all this reason has to be identified. Once the reason is identified, it's articulate appeal reasons. Okay. So You identify the reason, you articulate, appeal reasons, gather all the documents, leverage technology, and again submit the resubmit the claim. Okay, and then again you follow up regularly. So denial management also has to go through a proper flow. You cannot just every system has a process. Okay? So when we have a denial also, you understand what is the reason. You gather all the documents required. You correct the mistakes. You gather all the documents. You use technology to improvise on the claim submission, and then you submit. Now we have one scenario. A claim for a patient visit was denied because modifier 25 was missing when billing an evaluation and management service with a procedure. How should this be corrected? Okay, so now the medical coder did not put a modifier 25 in a EM service, that is evaluation management service with a procedure. So you need to understand, okay, this mistake, you go back, cross verify. Okay, you cross verify with the medical document and the code that was selected, and was it necessary that the modifier had to be selected. You gather all the information, okay, and then you resubmit. So add modifier 25 to EM code to indicate a separate significant evaluation was performed, and then likewise you correct all the mistake that had happened and resubmit the claim. That's all about understanding the common mistakes that can happen in coding and how to fix it.